Arterial bleeding during periodontal surgery can be alarming. In fact, nothing unsettles me more than uncontrolled bleeding. But if you know how to surgically manage these bleedings, you won't need to go change your underwear in the middle of surgery. Most common type of bleeding from the palate during connective tissue harvest, whether it's a pulsatile or constant oozing that won't stop, is typically from the accessory arterioles from the greater palatine artery. These branches typically traverse the palate vertically, so you want to try to ligate them horizontally. First, you'll need to have a large needle that is a half circle rather than a typical 3/8 circle due to the concavity of the palate. If you only have the 3/8 circle ones, you can gently bend the needle to give you the greater arc that you need. You also want a braided suture for better knot security, but monofilaments will still work as long as you can secure a tighter knot. You want the needle to go as deep as possible down to the periosteum in order to encase the blood vessel within the suture loop. But even if you don't, just the pressure from the bunching up of the soft tissue will slow the bleeding enough for the platelets to do their job. If you have an intraosseous arterial bleed, surgeons typically use bone wax. But the problem with bone wax is that sometimes it's hard to get it to stay, and it's not resorbed by the body. So the remaining wax could become an issue if you're planning to come back and place an implant in that site. So what I typically do is that I grab a solid instrument, either an elevator or an ocean beam chisel, and place it either directly over the vessel or adjacent to the osseous vessel and crush the bone towards the bleeding vessel. This will, once again, slow down the bleeding enough for the platelets and the coagulation cascade to work. Remember, when surgical bleeding occurs, first take a deep breath and remember that all bleeding will eventually stop.